when the president first announced them in early April, pharmaceuticals were exempted. But then about a week later, he made some remarks to the effect that, pharmaceuticals, a specific tariff on pharmaceuticals was probably in the works, starting at least 25% on these active pharmaceutical ingredients. So if that is implemented, then it's just one more thing where costs are going to possibly skyrocket.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
Today on Power Supply, we will speak with Nick Hutt, Senior Editor at HFMA. That's the Healthcare Financial Management Association. We're going to be talking about tariffs. It's on everybody's mind. I realize at the time of recording this, it's definitely a hot topic, but I doubt that by the time we air this in 5 or 6 weeks, it will be any less of a hot topic, Gary.
No, I'm really interested to see what Nick has to say. This volatile issue that we're talking about in tariffs, and set a baseline. That question comes up daily, and it's on the media every day. And I just want to see where he's going to kind of level set where we're at. What's the resources? What's the discussion amongst the C-suite and supply chain? And just share a great gamut from the HFMA world, which I think will be really useful to our listeners today.
All right, tariffs coming up after a short break. Stay with us. Nick Hutt up next.
Bam! I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Speaking with Nick Hutt, Senior Editor at HFMA, that's the Healthcare Financial Management Association. We're going to be talking about tariffs, and Nick has his own podcast. Gary, I know you are quite involved in HFMA and have gotten some guests on in the past, but Nick, you're the senior editor over there, so who better to come and talk about a very fluid topic these days in tariffs. Thanks so much for coming on the show.
Yeah, thanks, Justin. Absolutely. There's a lot of moving parts here in this discussion, but glad to be able to join you.
One of the biggest concerns I've had about doing a podcast on tariffs is it's so fluid. I'm worried that when we release this episode in 4 or 5 weeks, that everything we talk about is already going to be, a little bit dated. So we'll try to stay a little high level, and just for everybody who's listening, understand that whatever we talk about today obviously may have changed in the meantime. But I can tell you this has really become front of mind for so many supply chain leaders out there, especially as they're sort of navigating transparency with their suppliers and understanding components. And I've had a lot of conversations around kits and packs. And while you may not be at that granular of a level, Nick, it's just the further down the road we get on this, I think the more educated supply chain gets, but also the more uncertainty they begin to experience. Is it's not just as simple as saying, oh yeah, that we have to plan for this percent increase to just get tacked on or negotiate around it. It's a lot more nuanced than I think anybody had expected. So looking forward to getting your insights today. And maybe before we get started, just talk a little bit about your role with HFMA and promote your podcast.
Well, thanks. Yeah. So I'm a senior editor with the content team at the Healthcare Financial Management Association. We've got upwards of 130,000 members in various healthcare finance roles, mostly in the hospital setting, but other settings as well, like physician practices, certainly vendors. So as you said, that supply chain issues traditionally take a back seat on the hierarchy of topics that our members are interested in to issues pertaining to revenue cycle, reimbursement, especially these days with restrictions, potentially significant restrictions being considered for federal reimbursement. But with these tariffs and the potential impact, I'm seeing a surge in interest around the supply chain among our members, and just the ramifications for this policy, this evolving set of policies for their bottom line and their costs. And it's a significant concern, and just waiting. A lot of people are just waiting to see how this all shakes out.
Yeah. Well, it's interesting because I think we've encouraged folks in the past on shows that are in supply chain to potentially join HFMA just so, they kind of get exposure to the finances of healthcare, especially now that the CFOs have been paying so much, more close attention. I mean, even going back to 2023, Gary brought in Bray Manderson, who was the president of the Idaho HFMA chapter at the time. And we really just talked about HFMA and the benefit of joining to even those that are working in supply chain. And then, not too long after that, I want to say 6 to 7 months, we spoke with Andrew Donahue, who's on your team at HFMA, and was kind of looking out at what, the next 5 to 10 years was going to look like for healthcare. And we were talking about things like inflation. We weren't even considering tariffs. And so even since that interview, just a shout out to some people that are involved with your organization that have been on the show in the past. But yeah, I can see where financial leaders in the C-suite would care so much more about supply chain today, because we're under a lot of financial pressures. And, maybe you can talk about some of the other topics that just generally have been coming up. You said supply chain was a big one, and we'll dive into tariffs in a second, but what are some other things that, the CFOs that are part of your membership are really paying attention to these days in addition to supply chain?
The two biggest are always, I would say, revenue cycle and reimbursement. And those two things tie in together quite a bit. But revenue cycle entails things like, how do you maximize your payer relations? How do you avoid, this scourge? A lot of our members is how a lot of our members might describe it, of denials and barriers to getting your patients fast and efficient care through issues like prior authorization. And then reimbursement is, again, very much associated with the revenue cycle. But as a separate topic, you're seeing the potential, especially in Congress, as they consider, this potentially wide-ranging budget reconciliation bill. Could there be significant cuts to Medicaid that would very possibly ratchet up the amount of bad debt that hospitals incur, because fewer people would be covered when they have to seek care? And could it just leave hospitals in much more of a bind in terms of having to, serve the uninsured? They're not going to turn people away who really need care. If that goes through the way it's been described as being under discussion in Congress, some of those cuts, it would most definitely leave hospitals in even more of a pinch with respect to Medicaid reimbursement than they already are. And the reason they already are is because Medicaid reimbursement does not cover the cost of care. It's in the mid 80, around 85 cents, maybe a little bit more per dollar of healthcare expended on treating patients. So if that's already a very disadvantageous ratio. If that goes down even more, it could be, a significant concern for hospitals. Also, the Affordable Care Act marketplace insurance exchanges, those have been subsidized to a very significant degree in terms of covering premiums for people who can't really afford premiums in the ACA marketplaces. Those are set to expire after this year. And if Congress doesn't renew them, which I kind of think is a long shot, but you're starting to hear maybe they'll see the wisdom in renewing them, because even, the Republican voting base would be very much adversely affected. So we'll see. But if those go away, if Medicaid gets slashed, it's just not going to be a pretty picture.
Yeah, you're spot on. Would just be a larger population of uninsured. And if we're already shrinking, kind of the payer mix and the payer model that way, that's going to be tough. I'm going to use pharmaceuticals since you're kind of talking about reimbursement. We're going to use that to shift to tariffs because I think we're going to have another episode maybe later this season or early next season on pharmaceuticals. But, one of the things that's interesting about pharmacy is, you're not just going for lowest cost to do price cuts, and I know we do a lot of value-based purchasing and supply chain, in other areas, but with pharmacy, you have to kind of be aware of, what's the cost, but what's the cost in the relationship to what you're going to be reimbursed for those pharmaceuticals. And then depending on what country they come from, the tariffs could have a big impact on that profit margin, taking a really complex, I'd say, financial structure to pharmaceutical reimbursements and profit margins for hospitals and making it even more complex. It can be hard for hospitals to get their hands around that. Why don't you leap off of that and just kind of give us an overview of kind of where you see tariffs at today and maybe the impact on healthcare supply chain costs?
Well, as we said, it's hard to quantify or really summarize the impact of the tariff policy because it is shifting so much. But right now, there's 145% tariff on pretty much any good coming out of China. And that country is a source of a wide array of healthcare supplies that wind up at U.S. hospitals and doctors' offices. Canada and Mexico, there are exemptions in place for the tariffs that have been imposed if exemptions are based on a trilateral trade deal that was signed in 2020. But nonetheless, medical devices and personal protective equipment stand to be affected, I should say, in terms of price. That in turn could, increase the costs that hospitals and by extension patients, possibly even American taxpayers in general, that they incur. And for other countries, there's a baseline 10% tariff still in place, but larger tariffs have been paused for 90 days through approximately July 9th or 10th. So we'll see what happens once we get to that part of the calendar.
Yeah. So Nick, I'm just gonna bring it to the front. This is so confusing. Like we're moving at a moving target. To Justin's point, it could change in 6 weeks down the road. We've talked about the reimbursement side, HFMA, and we're hand in hand with ARM as well in the supply chain, and like merging these two different entities to talk about this as we move forward. But the baseline of information that we're trying to gather right now, you're setting a tone, which I think is really, really helpful of talking about that. But I see like this confusion creating so many different downstream issues on operations and logistics. And I'm wondering if you can talk about that a little bit, maybe what that's looking like, because we're talking about OTO, we're talking about the borders, we're talking about so many different bits and pieces of this from a top level perspective. But the downstream effect, can you talk a little bit about the operations and logistics of this, the confusion in the supply chain world? I've always thought of it as a drop of water. The ripple effect is so big. So maybe just speak to that a little bit for our listeners, if you could too, Nick.
Yeah, for sure. It's again, right now, there's a lot of uncertainty, and that's maybe the worst thing for a finance leader. If you get bad news and it's a set policy that is going to put hospitals at a disadvantage, you can deal with it. You can set your strategy, establish a baseline, and figure out somehow, some way to persevere operationally. But it's that much harder when you don't know. So I think the approach may be to plan for the worst case scenario, but it's still an abstract scenario with a lot of wild cards. So right now, it's definitely a stressful time trying to sort of game out what could happen. But yeah, it's just it kind of runs a gamut in terms of supplies that could be negatively impacted. Everything from personal protective equipment, so much of that comes from China, to medical devices, which you know, a lot of the parts come from China and India and really from a number of different countries. And then you have the pharmaceuticals. And that's one of the biggest areas of uncertainty, because when these wide ranging tariffs, when the president first announced them in early April, pharmaceuticals were exempted. But then about a week later, he made some remarks to the effect that, pharmaceuticals, a specific tariff on pharmaceuticals was probably in the works, starting at least 25% on these active pharmaceutical ingredients. So if that is implemented, then it's just one more thing where costs are going to possibly skyrocket.
Nick, I have a question. Do you even know, but are health systems currently doing a bunch of bulk buying right now, trying to get some in before the tariffs actually happen? Have you heard that?
That's a very good question. I haven't heard that. I know they're trying to take steps to just get a sense of what the impact's going to be. A lot of almost auditing of their supply sources. It kind of would make sense if they are doing bulk buying, but I can't say for sure it's happening. I've not heard that from any hospital.
Hayes, you bring up a really good point too. I don't know if you had a follow-up question, but I think too, like any type of capital equipment coming OTO, right, over the ocean, anything that has a tariff on it, your lead time, right? Lead times have got to be extended so far out. Even trying to develop a financial strategic plan within a hospital from an ASC to a critical access hospital district or a system is going to be rough because it's just going to take time and more time to plan.
It seemed to me, though, even the hospital side, they can expect their prices to rise, but they have no idea how much they're going to rise because it depends on the supplier, how much they pass on, right? I mean, you can expect, it's going to go up, but they don't really know.
And not every component's going to be subject to the same % tariff.
Yeah, right, because different countries are bringing it in different places.
It's also a logistic headache for the suppliers. How do they know what the mix is? And so if they did pass it on, do they, just to keep things moving, do they just go with the highest tariff that applies to every good in there? Do they try to dice it out and do it? I think it would also depend on how sophisticated the suppliers, pricing, libraries are and how quickly they're able to even, take a look at that. Nick, how involved are you with suppliers as part of this conversation, or is it strictly, healthcare entities?
Yeah, I'm much more sort of delving into the impact on our membership, which are the hospitals for the most part. So it's more looking at the supplier point of view through the eyes of their customers who are hospitals. And this is like a trickle down effect, but you just don't know what that effect is going to be at this stage. So first we have to get the tariff policy in place and cemented and make sure it's not going to be subject to change in a few weeks or a few months. Then the hospitals have to see exactly how their suppliers are going to respond. And because, again, I think I used this phrase at the top, but just so many moving parts, moving pieces in terms of what the potential impact could be, that it's almost right now, it's head spinning just in terms of trying to play out all the different scenarios, on paper, so you can get prepared for those.
Nick, question with your membership, and I know a lot of CFOs are part of that HFMA piece. Are they sometimes not even worried because, hey, I've got an agreement in place for 3 years. I've got an agreement in place for 5 years. I've got locked in pricing that I've already forecasted savings for 3 years. Do you think that is even a reality anymore, or is it amended contracts? Legal says no, they're going to have to pass this on, above inflation, above CPI. What are your CFOs? Are they talking about the agreements that are already in place and they're not concerned a little bit?
They're not resting easy about any agreements that may be in place, just because, for example, with group purchasing organizations, that's our structure that a lot of hospitals rely on, a great many rely on. Contract language allows for the terms to be amended, and something that requires preparation and strategizing.
So, Nick, like, as you're kind of talking with healthcare organizations, do you get a sense of some of the steps that they're taking, or do you have recommended steps that you've put out there as guidance, or is it still kind of the Wild West at this point?
We'll certainly, be in a position to possibly comment if, say, the administration opens up the policy to, makes it subject to change based on stakeholder feedback. I don't really anticipate that happening, but it could. But if anything, this administration is kind of tamping down on notice and comment opportunities, even in areas of healthcare policy and regulations that have traditionally been subject to notice and comment. So the guidance it's more guidance I've gotten from hospitals about best practices, and certainly, yeah, you said the Wild West, so it's just kind of trying to keep your head above water in some ways. But for example, the recommendation is to figure out what you're going to do if the most extreme tariff scenarios actually come to pass. How are you going to get by? And if it takes a while, a period of multiple years for better options to emerge, say in terms of domestic manufacturing ramping up, then how are you going to cope with that in the interim? So there's a lot of scenario planning, a lot of auditing of your supplies to try to really drill down into, your vulnerabilities. If some of these items, devices, PPE, pharmaceuticals, if they surge in price, where are you most vulnerable? Where are you going to have to look for alternatives? So it's just a lot of planning and doing your best to really try to get specific about how you could be impacted, even knowing that right now, any definitive conclusions are kind of fleeting.
But you have to think, right, that, we're kind of doing some doom and gloom, worst case scenarios. It's going to happen. But we've also seen, or at least I've heard reports that, 50, 60 countries have already reached out and said they want to negotiate. There's a chance, this is an outside chance, but some of the tariffs are going to be less than they were. Am I crazy? Then maybe China's not, but some of the other countries could actually come in a little lower than they were. Could that actually help prices in certain instances?
Yeah, it could. It could. It's just, I think you're better off planning for the worst case scenario. And then if it ends up being less severe, then great. You can breathe a sigh of relief and start spending in other areas that maybe you're going to have to cut back on. But sure, trade deals are very possible as a result of this tariff policy. But the one issue is that China is such a big and extensive source of a lot of different components in the healthcare supply chain. And it seems like that's the country where the Trump administration has the least amount of flexibility. Although just today, on the day of our recording, the president kind of softened his tone a little bit. So nothing is in the works in terms of reducing those, I don't think, imminently, but maybe there's a light at the end of the tunnel there.
A lot of health systems spend a decent amount of money in like renovations, new builds, construction projects. I'd say, supply chain's much more involved in that area than they ever used to be. And we know that the tariffs are going to hit some of these raw materials pretty hard, wood, steel, et cetera. Do you feel like hospitals, like one of the areas that they're going to throttle this potential impact until they get a better or a clearer picture of what it might look like? Do you think, like, are you hearing, some of the membership for HFMA say, like, yeah, we're just going to pause construction projects so we don't spend as much money while we wait and kind of like, because patient care is primary, right? Like, we know the way reimbursement is, the patient experience has an impact on that, but it probably doesn't outweigh the costs of construction efforts that might be underway to improve the patient experience, right?
Oh, definitely. I've not heard anybody say that they're pausing, capital projects that are already underway, but definitely considering whether they might have to pause some that are in the planning stages. One supply chain leader estimated that 80 to 90% of furniture is manufactured outside the U.S. a great amount of it in China. And so that's something that's not particular to healthcare. But if you're a hospital, a health system that's building a new wing or a new facility, off campus, on campus, what have you, those costs are going to be a lot more potentially than you might have thought when you were, initiating the planning stage. So for sure, there's just such a wide gamut of impacts that could arise from all this. And that's why just CFOs and other finance leaders are great at scenario planning. And I mean, that's one of the core traits or core skills that they have in order to get to their position in the C-suite. And those skills are really, they're really being forced to come to the forefront right now. So many different things that they have to think about.
Nick, you brought up a really good point, this scenario planning, and I was trying to think through that. If I'm sitting in that C-suite closed boardroom, identifying where our critical products are being bought right now and where they're going, and what can we do? Are you seeing a shift to identify tariff-exempt suppliers locally, regionally, really truly identifying? Because really it's all about the delta, right? If you're buying X and it's with China, let's say, for example, and it's X amount of dollars, but if you can now go regionally, locally, and it's a higher price, but it offsets the tariff issue, are they looking and identifying those scenarios that you brought up to really look closer in our U.S. in that direction? I've heard that stated numerous times. Are you seeing that shift of at least planning in that direction?
Definitely a shift in planning in that direction. However, if too many systems, hospitals, organizations, different facilities, what have you, look in that direction, these regional, local, and domestic suppliers just don't have, in many cases, the capacity to serve, such a possible influx of new demand. And so, I mean, really the point of the tariffs is to kind of spark new manufacturing, new levels of manufacturing in the U.S., but that's going to take a long time. It's not going to happen in a matter of months or anything to really meet the potential demand. And in order to make, these levies, these tariffs, non-factor for hospitals as they try to maintain their supply chain, it's going to take a period of years probably. So, they're probably running in that direction that you described, but not everybody's going to be accommodated.
Nick, are you aware or involved in any lobbying efforts to advocate for hospitals? Just in general in DC? Just sort of curious, any of your insights on how those efforts might be coming along.
As a matter of fact, HFMA does not lobby. We do send in, I mentioned this a little while ago, but we comment when on whether it's, Medicare payment rules for hospitals, what have you. We comment when there's an opportunity to do that through notice and comment periods. But right now, the tariffs are just kind of a unilateral policy coming out of the White House, and there's no opportunity to do that. So the American Hospital Association is certainly lobbying. They're trying to get exemptions for a lot of healthcare supplies and pharmaceuticals as well, pharmaceutical ingredients. So far, the administration has not met those requests and changed its policy, but I know they're working hard on that. So maybe eventually their efforts will bear fruit. Let's see.
Nick, just for our listeners, and I'm thinking through this and selfishly for me as well, where is a place where I can keep up to date on tariff changes versus the media, where I can get concrete, black and white information thus far as it changes? Do you have a recommendation where a good source, legit source, to get the information that's coming?
Well, I can put a plug in for our news coverage at hfma.org. You can just click one of the topic categories at the top of the page to get to our news. And the American Hospital Association, again, they're staying on top of this. It is one of the foremost issues for their members. So I try to read them. There's others, but yeah,
It's confusing. That's why I'm asking, Nick. It's just there's so much going on, and I'm trying to. If I get that question, who do I direct? Where do I go to for the source of truth? I mean, when the pandemic came, we had a really good source of truth on our podcast, and I'm telling you, like, this is another issue that's coming down. That's not going to go away anytime soon. And I think about so many downstream effects of legal language that's going to be tariff worthy, like lock-in pricing. These kinds of scenarios are coming down that place. So I want to make sure we have a resource. So I heard two of them there, and I really appreciate you sharing that.
For sure. Yeah. It's just so much to try to stay on top of, so many details to try to soak up. And the shifting landscape just really, really exacerbates the challenges. So yeah, hopefully we'll do a pretty good job of keeping folks up to date. And I'm sure the AHA will as well.
Hey, Nick, would it be okay if we just give everybody your mobile phone? They can just call you anytime.
Yeah.
You okay with that?
Yeah, I would love to have some outlet to call with any random question. There should be a hotline or something.
Yeah. All right, good. I'm glad. We'll just share your mobile number, and now we have a hotline.
911, 411. I mean, either one of those, right? I'm not telling anybody to call that. Thank you.
And it may just be to give people a outlet for venting about the state of affairs.
So you're good with that. They can call you and vent too.
That's right. Rant away, and I'll
what a service to our
I'll be
industry.
happy to hear you. I mean, honestly, when I do talk to some of our members about this, that's what it comes down to, is just hearing them out, and they hopefully feel a little bit better when they get it off their chest.
All right, Nick, great interview. Again, by the time this releases, there may be, some changes, but I think you also gave us an outlook for the rest of the year and some other things to be paying attention to and the overall considerations as we sort of navigate this. Really appreciate you coming on. Congrats again on the success of your podcast. And I think we've probably shared some guests here recently. I think the supply chain and finance worlds have converged quite a bit over the last, 6 months or so, maybe more than they ever have in the past. And so really appreciate from one podcast to another, you sharing your insights with our audience today.
Well, thank you for having me. I really enjoyed the discussion. Happy to come back on with you as events dictate. I should have said this at the top when you asked about our podcast, but my colleague Erica Grotto is sort of the overseer of the podcast, for lack of a better word, and coordinates it. I get to appear on it regularly, which is great, but she's the one who makes it go. So I just wanted to mention her as well, so people don't think I'm the spark behind all this.
That's okay, Nate, because Gary takes credit for ours, so it's okay.
So wrong.
That's how it goes sometimes.
Well, very similarly to us having more finance conversations on
Absolutely.
this podcast, there's obviously a lot more supply chain conversations happening on the HFMA podcast. And so again, Nick, congrats on your work and Erica's work over there. For anybody who's interested in sort of staying up to date and having a broader finance perspective, with healthcare, definitely check out the HFMA podcast as well. And Nick, I believe your website's hfma.org. That easy, right?
Yes, indeed. That's short and to the point.
Excellent. All right, that was Nick Hutt, Senior Editor at HFMA, talking about the impact of tariffs on the healthcare supply chain and really the entire healthcare organization, Hayes. I think Nick gave us some things to definitely keep an eye on, but he couldn't really be certain on anything because I don't think anybody can. That's what's making it sort of difficult to plan and strategize and pivot around. But I think we'll all be keeping an eye on it. Some answers will definitely become clear. But it was interesting because, yes, we're talking about some things that are happening right here and now, but there are some milestones, including towards the end of this year, to really be keeping an eye on.
Absolutely. And it is, to your point, it's just, it's so vague right now. We don't know the good, the bad, the ugly. We don't know any of that yet. But I mean, if you listen to the podcast, you'll certainly understand that he's going to give his mobile number. And so you could call him 24/7 and he's going to provide any updates that they have. So, but really he did a great job framing the whole issue of tariffs. And hopefully, in another 60, 90 days, we'll have some of this ironed out and it's actually better for all of us. So, but he did a wonderful job and he was a great guest.
All right. Well, definitely check out the HFMA podcast or head on over to their website, hfma.org. Could be a great resource for supply chain leaders out there today trying to understand the financial lay of the land, I guess, with healthcare today and especially around the tariffs, but other things related to reimbursement as well. So on behalf of Hayes, Gary, and myself, thanks for listening to this week's episode of Power Supply.
Bam!
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.